Heart failure is often considered as an illness of older age, but today it increasingly affecting people in their 20s, 30s, and 40s, especially in India. The rise in sedentary lifestyle, the unchecked stress, poor eating habits, either it would be smoking or the early onset of diabetes and also the high blood pressure is contributing to a troubling spike in heart issues among the younger population. In this session, Dr. BVA Ranga Reddy sheds lights on growing prevalence of heart failure in young Indians, what's driving this shift, and the most importantly, what can be done to prevent it. Because when it comes to heart health, awareness and timely action can be life saving. Dr. Reddy is highly respected consultant interventional cardiologist at Apollo Hospital, Jubilee Hills, Hyderabad. He holds an MD, DM, and brings years of experience in diagnosis, treating, and preventing a wide range of cardiovascular conditions. Known for his evidence based approach and deep commitment to patient care, Dr. Reddy has been at the forefront of cardiac interventions and preventive cardiology. His insights today will help us better understand the rising cardiac risk in younger populations and what steps we can take to protect heart health early on. So, with this, we'll start with the conversation, doctor. So, my first question to you is why are we seeing a rise in heart failure cases among young Indians, and what are the primary causes behind this trend?
Hello, everyone. As the urbanization is going on, increasing, especially the young individuals, where they're very enthusiastic and they're career driven, and they want to do something more than what they uh, have seen in their life. So now we are seeing a different set of lifestyles in urban population, especially young individuals, around 30 to 40 years, where they would have shifted from one place to another place. The lifestyle will be changed. The dietary habits will be changed. The sedentary lifestyle will comes into the picture. There are a lot of metabolic disorders which were undiagnosed or underdiagnosed in these set of patients or the individuals, where which hits early and causes this heart failure.
Okay, thank you, doctor. So, with this, our lifestyle factors, like I've said, is stress, diet, and the lack of exercise also more dangerous for young hearts than we previously believed.
Yes, there are a lot of evidences which show that lifestyle factors it plays a very important role than we assumed previously. There's this chronic stress, irregular sleep, and the processed food which we use daily on a day-to-day basis, and also it causes a very bad hit on the health and especially on the heart. So, as we are talking about the day-to-day regular activities, especially the people around the age of 30 to 40 years. And we have a lot of means of transport where we don't have a proper physical activity. And the sedentary habits are causing, because of this modern conveniences, it's causing more of like the accumulation of this, which in turn converts into the metabolic disorders. So it studies there are a lot of studies which they have revealed, saying that there is almost a 5 year deterioration in a lifestyle when the lifestyle, if the lifestyle is not good and if it's not being maintained properly, there is almost 5 year deterioration. Normally, our South Asian people itself, they have a high preponderance to have a cardiac disease, high chances of getting diabetes, hypertension, and metabolic disorders. So we can see, if you compare with the Western world, there is almost a 1 decade early we see heart diseases in the South Asia people. So there is almost a 5 to 10 years variation, or if you don't have a proper lifestyle, and it can increase the heart attack, and it can cause the heart failure, and there is a mortality risk is there.
Okay. So, doctor, how can underlying conditions like this diabetes, high blood pressure, or obesity contributes to early heart failure, especially when it is undiagnosed?
So these we call as the silent killers, where if we are not being diagnosed somehow or other, like doing investigations or some other, we go for some other condition, we go for some injury, we get this test done and we diagnose these things. These are called like silent killers. Uh, so type 2 diabetes and insulin resistance is one thing which we are seeing in a lot of young individuals, and not maintaining a healthy diet and active routines, and if you don't have a regular sleep, so it almost causes like like if you, it's a higher incidence of having a heart disease. Also, almost I can say like 50 to 60% higher than individuals where they have a good eating habits, active routines, physical activity, and who doesn't smoke and who have a very good sleep. So they have a very good expectancy to have a better heart health than the people who have these things. And type 2 diabetes, insulin resistance, hypertension, obesity, which almost all are interlinked, which per se causes this heart attacks, heart failures, and weakness of the heart. We say stress-induced cardiomyopathy. We are seeing in a lot of individuals where they're coming with an heart failure without even having an heart attack. So these are the things which we underdiagnosed. If the patient is having diabetes, they may not have symptoms until unless their heart is completely failed. And if the patient has hypertension, diabetes, obesity, metabolic syndrome, their vascular health fast forwards very soon. We can see the age it's going on coming down as compared to the our old age. If you see our parents, grandparents, and their generation, we used to see very less having the heart failure or heart diseases. Especially during 30s and 40s, we always see people who have this heart failure, heart diseases more than 50, 60 years minimum. So even 50 years before, we used to treat them as like a moderate age, not like very excessive age also. So these are the like main things where underdiagnosed or undiagnosed, which per se causes and affects your heart too fast.
Yes. So, doctor, just to have mentioned about the symptoms. So, can you please tell us what symptoms should young adults never ignore when it comes to their health heart?
Yeah. So we, that's why we always say that a daily routine of a physical activity or daily routine having a good, healthy diet helps you to identify something early. So we say like signs and symptoms. We say if you go for a regular walk, so it will, if it causes unusual fatigue, early fatigue, when you are not able to do what you are able to do in the last week, you are not able to do this week. So that's called early fatigue. Or even if you feel like any breathlessness or any swelling in the legs, ankles, like persistent cough, leg cramps, or feeling fainty, dizzy, palpitations, irregular heartbeats. So all these are symptoms generally we tend to see if we are active. If we are sedentary and if we are not moving much, we may not find out these symptoms on a regular basis. And people who are not having enough sleep, and people who are coughing, and then they're having breathlessness during their sleep, and it's taking time for them to sleep. So those are also, we say, they are the signs and symptoms, like generally symptoms which we see in heart failure. So if anyone finds these symptoms, if anyone feels that they're not able to walk enough, or they're feeling some uneasiness, they're feeling dizzy, they have ankle edema or the leg swelling compared previously. So those things we need to identify and quickly consult a physician or a cardiologist, and see how their baseline heart health is.
So, doctor, can you please tell more about what steps can young people take today to reduce their risk of heart failure later or even sooner in life?
So I can say young individuals who are very enthusiastic and they want to do something more in their future life. So having their heart health being checked, and at least, like I always tell, when a patient comes who is young and have a family history, or they want to keep their heart health good and active. So we need to check your numbers, not the bank balance or any other phone numbers. You need to check your numbers, like blood pressure number, cholesterol number, and sugar numbers. Even if you are 20 or even if you're 30, 40. So you need to monitor that regularly, not so frequently, but on a regular basis at least. And healthy diet is one thing which most of the people lack in their day-to-day diet. So they always feel like, okay, diet doesn't play much role in our life. Okay, today we'll have something outside, or tomorrow, this week we'll skip it. So it's not that. Basic dietary healthy dietary habits which you incorporate in your day-to-day life, at least 5 to 6 days in a week, will have a very good benefit on your heart health and overall condition. Even diabetes, hypertension, metabolic syndromes, or obesity, all these things, this diet plays a very important role. And having a physical activity on a regular basis, at least 2.5 hours in a week, we suggest to have a physical activity, at least a walking, doing some exercise, playing a game, muscle strengthening, or stretching. Any sort of physical activity will help have a very good metabolism in their body, along with a healthy diet. And quit smoking, and have a very good sleep. So these two things will have a very positive effect on your body. And smoking, we see a lot of young individuals where they come, almost like, if you take 10 patients who comes with a heart attack or heart failures, almost 50 to 60% of them are having this smoking habits or the obesity and all. Sometimes I can say, like, go to say 70% also. So quit smoking as early as possible if you're already smoking. And limit alcohol usage also. Binge alcohol drinking has a lot of bad metabolic effects on your body. So binge alcohol is not good for your body. And timely check it, and have a good physical activity along with the dietary thing. And like, often once in a, like, when you go out or when you go for a party, having a minimal alcohol will help you have a very good metabolism in your body. So, and one thing I can say, the annual checkups plays a very important role, especially people who works in a corporate fields. Now most of the corporates, and they are inculcating that annual checkups needs to be done for the individuals, workers, so employees who work in the company. So annual checkups are very important. If you have any comorbid conditions, any family history, any genetic issues which runs in the family, so those people should have checkups more frequently than regular individuals where they don't have any comorbid conditions. And being aware of all these conditions, like we are discussing about the symptoms, what are the symptoms we see in heart failures, or even the any chest discomfort, uneasiness, fatigue, breathlessness, exertional breathlessness. These things you need to watch. And basic investigations will help you to have a better diagnosis. Pre-diagnosis is always better. Heart muscle is, like we say, like muscle is time, where if you lose it, it will never come back. So being aware of all the symptoms is also an important factor which we need to consider. And stay informed about the risk. What are the risk factors you have? And are there any other risk stratification you can do to avoid, or to know the diagnosis earlier? And what all needs to be done to prevent having that. We always say, we always talk about a 10 years risk. So what's the risk in 10 years? What's the risk of
Yes.
having heart issues, or what's the risk of having a sudden cardiac death, or having this diabetes, all these things. So we always talk about the range than a specific number. So just try to understand what your physician says, try to acknowledge it, and based on that, you calculate your lifestyle, or plan your future.
Thank you, doctor, for his advice. So, as we conclude today's important session, we extend our heartfelt thanks to Dr. B.V.A. Ranga Reddy for sharing his such a valuable insights onto the rising risk of heart failure among young Indians. His clear explanation and the practical advice has helped us to understand that heart health is no longer just a concern for elderly. It starts much earlier than the most of us realize. And to everyone who joined us, thank you for being a part of this conversation. We hope today's discussion encourages you to take preventive steps Listen to your body and prioritize regular checkups no matter what your age is. Stay tuned for more knowledge packed sessions on health and wellness. Until then, take care of your heart, stay active, and don't forget to follow us on social media handles for more such informative updates and healthcare tips. Dr. Rangareddy, once again, thank you so much for joining with us.
Thank you.